source of that can tilt the patient towards crisis is exercise. So exercise is good, but extreme exercise, especially for patients with sickle cell, is not good. So, but mild and moderate exercise is good. So coming to this diagram, this is a diagram of a carrier, AS. They are carriers, meaning they have one abnormal gene for sickle cell, which is SS, and AA is the normal type of hemoglobin. So there are various types of hemoglobin because this sickle cell disease now is the abnormality of the hemoglobin, meaning the hemoglobin is a protein in our blood that helps to transport oxygen to our tissues. So when these hemoglobin they are not normal, they will not be able to transport this oxygen to our tissues in appropriate condition. So it will lead to sickle cell disease. So now, let's say this is the father, AS, and this is the mother, AS. So now, let's try to do some calculations. Now, A can meet with A in some conditions which they can give birth to AA, a child with AA, which the child will be normal in a 25% condition. And also A can also meet with S. A can meet with S, AS, which is a carrier. So the child will still be normal. Then AS will meet with what? With A, AS. These two conditions now is 50% chance of having AS. 25% chance having AA and 25% chance having SS. Now this is just a probability because AS can meet with AS and all your children can be SS. And also AS can meet with AS and all your children can be normal AA. And also AS can meet with AS and all your children will be AS. So it's just probability, the chances. So now, that is why it's important to know our genotype. You have to know your genotype, you have to know the kind of hemoglobin you have. If it is AS, then you can't marry someone that is AS because there's risk of giving birth to 25% chance of giving birth to someone that is SS. So, but if you are AA, you can get married to someone that is AA, and this is like all your children will be AA, and if you are AA, you can also marry someone that is AS, and all your children will be either AA or AS, which is AS is like a carrier. The condition is recessive, meaning it's silent in the person. Except in conditions like severe hypoxia, meaning when there's extremely low oxygen, like when the person is flying in a plane, that can happen, that the person AS can have crisis, but it's not as common as SS. So we have other form of hemoglobin. It's not only AA, AS. We have other form of hemoglobin like hemoglobin S. We have hemoglobin C, hemoglobin D, and yes, these are the other types of hemoglobin that we have. But these two types of hemoglobin, they are not common in Nigeria or in Africa. They are common in the Mediterranean region like Europe, the Arab region. So, but the common hemoglobin that is found in Africa, Nigeria, we have the hemoglobin A, S, and hemoglobin A and S. C and D is not common. And there are some rare occasions where some people have hemoglobin C, even in Nigeria. So, when you see someone with hemoglobin SC, this person will be having crisis as someone as SS. They're having the same clinical presentation because this hemoglobin now, SC, they are both abnormal. Because the normal hemoglobin is A. So they're having both abnormal hemoglobin. So there will be sickling and there will be crisis. The person will be having a lot of crisis. So now talking about crisis, we'll be talking about some crisis which Number one is what we call the vaso-occlusive crisis. Now, this crisis, when this, the reason why it is called sickle cell is because of this hemoglobin will polymerize, that is, they will join together and form a sickle-like appearance. It will be like this. It will be sickle like this. Sickle-like appearance. Unlike the normal anatomy or the normal presentation of red blood cell that is normally it's like a disc, just like our home disc at home. It's just like a disc. This is the normal form of hemoglobin or red blood cell. But now, when this sickle cell polymerize as a result of all these antioxidants we mentioned earlier, that is the dehydration, the emotional stress, and the rest, they can cause the hemoglobin to polymerize. They will clump together. So once they clump together, now they will form this sickle cell appearance. Now, in our body, we have what we call the arteries, the veins. In between the arteries and the veins, we have the capillaries and the veins at the other end. So, normally, this disc-like cell that is normal usually maneuver its way inside the capillary without causing any problem. But now, we have abnormal sickle shapes with tapering end, meaning with sharp end. They cannot maneuver their way into these small capillaries. So the patient usually comes down with pain. They usually have pain. They usually have they are usually anemic because they cannot even it cannot cross those barriers. So now we have acute chest syndrome. It's one of the most clinical and the most classical form of vaso-occlusive crisis. So if you see someone complaining of fever, difficulty breathing, and pain, and is a known sickle cell, please refer that patient quickly to the hospital. That patient might just be having acute chest syndrome. It's an emergency and it needs to be taken care of. Also, there are some other pains like in males, they can have painful erected penis, which is called priapism. And it usually occurs in men due to this sickle shape abnormal hemoglobin. Now they are inside the penis, inside the circulation of the penis. So they usually come down with painful erected penis. And there are also other various forms of vaso-occlusive crisis. It can occur anywhere. It can even lead to stroke. It can lead to renal dysfunction. You know, sometimes you see some sickle cell patient coming down with hematuria. Hematuria meaning there is blood in the urine. So that is a sign of kidney problem in sickle cell. So we have what we call the sequestration crisis. Now there's an organ in the body known as the spleen. So this spleen is responsible for removing dead red blood cells. That is, red blood cells usually complete their days after 120 days. The spleen usually gets rid of them. So when this sickle like abnormal cell now enter the spleen will be exhausted because there will be a lot of infarction, there will be a lot of necrosis. So it will cause the spleen to be doing a lot of work. So that leads to hypersplenomegaly. That means that is why the stomach is usually increase. There's increase in the stomach size because of these activities that is happening in the spleen. So also there's other crises like the hemolytic crisis. The person will be severely anemic. The person will be having symptoms of anemia like dizziness, fatigue. The person will not be doing low energy. So now let's talk about the treatment. Now the treatment for sickle cell, it depends on the kind of crisis they come down with. Now if it is a vaso-occlusive crisis, just like I told you, oxygen plays an important role in hemoglobin. So when the person comes down with vaso-occlusive crisis, you want to give the person oxygen, you want to give the person enough fluid because dehydration too can precipitate the crisis. You want to give the person pain relievers to relieve the person from pain. Also, you want to give the person some antibiotics because there can be some infection that is triggering. Sickle cell patients usually are triggered by some infection. Some infections like pneumonia, UTI can trigger this crisis that we just mentioned. So, also we want to transfuse the person. We want to transfuse because they usually come down with anemia. That is this increased rate in the breakdown of this abnormal hemoglobin. So they come down with anemia. Then also there's a drug known as the hydroxyurea. Now this hydroxyurea is given. The function of this hydroxyurea is that it increases the hemoglobin F levels. Now in kids that have sickle cell, the first 6 months is not usually manifested because of this hemoglobin F. It's a fetal hemoglobin that usually occurs, that is usually in infants. But after 6 months, they begin to manifest the symptoms and signs of sickle cell because this hemoglobin F is converted to beta hemoglobin, and this beta hemoglobin is what is responsible for this abnormality. So when you give hydroxyurea, what it does is that it will increase the level of fetal hemoglobin so that the abnormality will be, the crisis will be reduced in sickle cell patients. So part of the prevention is that sickle cell is a very crazy disorder or disease, but it can be prevented. How can it be prevented? Number one, know your genotype. Yes, I know that love is a beautiful thing. You know, you love this person, but you also love your kids. Know your genotype because of your kids. Very, very important. Before you get married, know your genotype. If you are AS, you have to get married to someone that is AA. If you are AA, you can get married to even an SS. Yes, you can get married to even an SS because all your children will now be AS. So genotype is important, and we should also try to educate ourselves on sickle cell disease. Thank you very much. Till we meet next time.